In 1983, the Sisters of St. Joseph decided that they needed to build a new clinical biochemistry building. And then some inspired physician investigators said, why not build a few more floors on top of that? And let's have our own research institute for St. Joseph's Hospital. And it was about that time that teaching hospitals all around Canada were realizing that hospitals actually had to innovate. They didn't just practice medicine, they had to innovate and create the next generation of medicine as well.
St. Joseph's Hospital is one of 24 academic teaching hospitals in Ontario. And every year we have over 900 students, medical students, residents, fellows who train here. As well, we have over 1,200 trainees in other areas, allied health such as nursing, physiotherapy, occupational therapy, nutrition, and so forth.
For more than a century, St. Joseph's Hospital has dedicated itself to educating the healthcare professionals of tomorrow and to conducting research that today is transforming the healthcare landscape across the country and around the world.
It's no surprise that since we consolidated research in the hospitals in 2000, Lawson has grown by leaps and bounds. So we're now the 8th biggest research institute in Canada, the 5th in the province of Ontario, with an annual budget now of external grants and contracts around $88 million a year. We could truly form interdisciplinary research teams across the city. We can put together teams with all the right skills to tackle any particular problem.
With a focus on discovery and healthcare of the future, St. Joseph's, with the support of a generous community, has adopted state-of-the-art equipment and technology that is transforming care for patients. The emphasis is on translational research, which means applying knowledge directly to patient care.
We're fortunate to have clinicians here who are continually asking, how do I do this differently? How can we take knowledge that has been learned through the process of research and bring it back to care?
Well, I think what's really neat about St. Joe's is we have groups in various aspects of surgery that are leaders in their areas, developing the new techniques in their laboratories and taking them to the operating room here at St. Joe's and showing their benefits. We can provide that care to our patients right here at St. Joe's.
Clinical research often gives us the direction that we should be taking our care in. We do so much research here at St. Joseph's Healthcare, we immediately can translate that into the care of our patients. So our patients benefit from participating in research not only as an individual, but they also benefit others who have the same disease, because once we learn that this is a better way of treating patients, we immediately take it forward.
This translational research is embedded into the student experience, allowing them to benefit not only by learning about the most up-to-date techniques, but seeing and using them in practice, in the clinics, therapeutic spaces, and operating rooms. Students are excited to be at St. Joseph's Hospital and to learn.
Well, because what we do here at St. Joe's is innovative, what we can provide here is often translated to other centers. We're all educators and we all lecture widely, so what we learn here, we teach elsewhere.
As a great example, we are doing a live surgical broadcast from the operating room here at St. Joseph's around the world, to Brazil, to China, across the USA, and elsewhere. So this includes simultaneous audio and video transmissions. That has the potential to impact then hundreds or thousands or even millions of patients.
The transformation of the physical building of St. Joseph's Hospital and the work underway within its halls has been monumental. Yet the spiritual foundation remains untouched. St. Joseph's remains committed to both faith and science while continually looking ahead.
Faith in God and faith in science are not incongruent. They come together. We're called to do the best for each other. That's through research. That's through innovation. Analyzing, is this the best path for us right now to attend to the care of the body, the mind, and the spirit? So the faith in God and the faith in science support in and of one another.
One of the joys of being a leader of this organization is we always look forward to what we can do, and we don't dwell on the limitations that may be placed on us when it comes to funding or resources. some of the learnings that we take forward from the past are really an adaptability and an ability to respond to the changing culture and the changing healthcare system and the needs of the community that we serve. That's a legacy from the past that we have learned from the sisters. They were very adaptable. They were people who responded to the changing world around them and changed their care. They were the people in this community who established the first care environment for people living with HIV when the world was really afraid of HIV. But they responded because it was a need of care within our community. That's the legacy of care we have. We want to be sensitive to the needs of our community, and we take that ability to change and adapt with us into the future and respond to the future needs as they present to us.